memory and mind trainer. So it's a privilege to be able to attend sir's session. Please utilize this opportunity. You can always contact sir if you have any doubts to ask, or if you need any help from sir. So sir will start his session about acupressure for self-healing today. Sir, welcome sir. Srinivas Rao sir.
Yeah, thank you, Sandhya.
Welcome sir.
Good evening, everybody. Yeah. Are you able to see these slides? Okay, so we'll just give 2 minutes for others to join. So before we make it further, what I would like to state is that, like last week we have discussed about the many alternative therapies what I have been practicing and how they can be useful for the people, either for the self or for the knowing themselves, etc. So as a brief introduction, it's a good introduction she has given. I worked in ISRO Satellite Center for about 13 years. And then as a scientist and worked for about 12 satellites as an orbit determination and predictions. Then in Hewlett Packard, I was working for 16 years in various program management and product management roles. I was India operations manager. And I have been practicing Acupressure since 1993-94 onwards. And I have very good experiences. So I learned over a period of time since 93-94 to till recently also, like pranic healing, access bars, color therapy with Ayurvedic acupressure, color therapy, etc. So many things. So the last week, what we have discussed is about some of the therapies, which I'm going to review in 2 minutes, all those things, whatever we did. So I thank everybody, all the gurus of mine, including my mother, father, my spiritual guru, Mataji Krishnapriya and Sharmaji. Then also my first acupressure guru, Dr. Bhojraj from ISRO scientist. And then many gurus who taught me pranic healing, acupressure, pranic Ayurvedic acupressure, color therapies, etc. So with all the blessings of the gurus, I am making it here. So most of the information what I have collected and making presentation is based on what is available on internet and then freely available. So I'm not claiming of anything of my own myself or my creations here. So with all the due regards to all the publishers who put it on to the internet, thanks for everybody, those who have put it all the information on the internet World Wide Web. Thank you. So last week we discussed at length about the DMIT, that is career counseling and how it works, and then how each personal characteristics will come to know from DMIT test. That is from the fingerprints. You get the fingerprints. We generate about 45-page report, and we know the multiple intelligence of individual and inborn potential, like leadership qualities, managerial qualities, why a person behaves as they are behaving. So, and we also guide them for the what right studies, right job, right vertical, etc. with the DMIT. And then also we discussed about the energy as well, where 90 cognitive abilities we discuss about. Whatever that from for the this career DMIT can be taken from the age group of 3 years to 80+ years also, because individuals at the late ages we have seen how they can perform and how their stress can be removed. And for middle-aged group of people, like 30s and 40, 50s also, what next, what they want to do, what they want to pursue their career, their interests, etc. It will help a lot. Then we have seen this 90 cognitive skills, how the critical thinking, decision making, and then usage of the words, and then how it will be useful, and how people can enhance their cognitive skills, which can be useful for their curriculum. We don't exactly teach the curriculum, but then the skills what they learn in Energy SOI will be useful for them in solving their school-related problems, school studies, etc. And we also discussed about the access bars. There are 32 points in the brain. Just by touching those points, we create the energy clearance bars like a pipes. Energy free flow of the energy will happen, and the blockages will be removed. And several cases we discussed under the access bars how without any medication people can solve their problems. Then also the backflow remedies are the 38 remedies which will work on our emotions and feelings and what we say, and then like they work for the anxiety, fear, known fear, unknown fear, exam fears, then lack of courage, lack of adjustment, like various emotions, almost 100 plus emotions we work on with the backflow remedies. Other day when I was searching in the internet, I found that 270 emotions are there. So categories and subcategories may be there. So with the pranic healing is again a non-touch therapy where we cleanse the aura and chakras without touching the person. And by cleansing the first, any physical problems will manifest on the aura and then they come on to the physical body. When we are clearing the aura and energizing the aura, the physical problems also will reduce. So this is what we have learned in the last session. So today I'm going to talk mostly on acupressure and acupressure related therapies. There are 3 or 4 variations in acupressure. So we'll cover exclusively today, and with some of the some of the life-saving points, which we can use it here. And then again, one of the notes what I want to say is here, in emergencies, please visit the regular physician and your hospital. And this is only the awareness program, and there where we are trying to help each other to know what are the other modalities of the healing mechanisms that are there available. Because today most of the people do not know about how many techniques, what are the techniques and all, and alternative therapies, what are the alternative therapies. So my interest here is because I learned over a period of time. So I thought bring the awareness among the people here. And the healing and cure period differs from person to person as each body constitution is different. So we discussed about all these things here, and these are some of the emotions, that sadness, stress, fear, anxiety, self-concern, interfering with the other people, panic attacks, jet lag, phobias like lift phobia, tunnel phobia, night phobia, like this. Okay. तो अभी जो भी आप लास्ट वीक डिस्कस किया था वो पूरा acupressure, pranic healing, backflow remedies, and to some extent in hypnotherapy also we discussed. Hypnotherapy में most of the times अभी meditation जब हम करते हैं, meditation में भी हम hypnotic suggestions देते हैं. So basically hypnotherapy में क्या होता है, तो we go into the trance. From the conscious level to the subconscious level we go, and in the subconscious level we try to give the suggestions. So either others will give the suggestions at subconscious level, or you yourself can give the subconscious level. So one of the things what I would like to tell is when जब हम 5 बजे सुबह में 5 बजे को फ्लाइट में जाने का होता है, कोई भी फ्लाइट मिस करने का इच्छा नहीं होता है किसी को भी, क्योंकि फ्लाइट चार्जेस आर मोर। वंस दे फ्लाइट मिस हो गया तो दूसरा फ्लाइट टिकट मिलना भी मुश्किल है उस वो फ्लाइट में मिलने का। तो सोने के टाइम पे क्या करते हैं, अब 5 बजे को हम उठने का है और 5 बजे जाने का है, 3 बजे को उठ के तैयार होना है। वो ऐसा सामान, ऐसा commands. Subconsciously we think, and we keep on waking up in the night for every 1 hour, every 2 hours. Oh, it may be 3 o'clock, like that it is. So this, when we give this kind of a subconscious suggestions to the mind, it is a hypnotherapy. Okay. So normally अभी जैसा मूवीज में देता है दिखाता है, हिप्नोथेरेपी का गलत उपयोग करना और उसका रॉन्ग इम्प्रेशन क्रिएट करना और रहता है उसमें। उसी का वजह से डर रहता है किसी के जाके हिप्नोथेरेपी करवाने के लिए। तो उसमें क्या होता है, कोई भी अपना विलिंगनेस नहीं है तो अपना आप हिप्नोटाइज होने के लिए इच्छा नहीं है तो कोई भी हिप्नोटाइज नहीं कर सकते। ओके, सो दैट इज फॉर गारंटी। So then we will schedule this Vastu corrections for some other session, because we use pyramids extensively for correction of the energies within the house, office, etc. So we will go for this pyramid session separately. Today, so we will focus more on the acupressure. So acupressure has again there are zone therapy, reflexology, then auricular therapy, then these are all derived from acupuncture. Acupuncture is basically, we know it is a thousands of years old Chinese traditional Chinese system it is. From there it is derived, and in India we did lot of India there is a research that is going on, and we have a lot of innovation that has come up. Ayurveda is from India, and as you know, from the Ayurveda, there is something called the Ayurvedic acupressure that has taken birth. And in this one, Ayurvedic acupressure, we will see how Ayurvedic principles are applied, and this is closely matches with the Sujok therapy and Ayurveda principles and color therapy. With the sketch colors, we will be solving the problems of the people. Okay, so I think how many people are there? Just I will want to see here. How many are looking for the English and the Hindi, both are mixed, or only Hindi people are looking for, or English?
Mix,
Mix is fine. Okay.
yeah, mix is better.
Okay, okay. So there is a message to me saying that we go for only English. So okay, mix करेंगे ऐसा ही. So the acupressure, nothing to worry about this, though there are say various variations. 5,000 साल पुराना टेक्निक है acupressure. Initially traditional Chinese method, we call it TCM. उसमें क्या होता है, prana, negative and positive energies they talk of. Okay, Ki and this one, prana. And here, what we are going to talk is just a few minutes of the variations. First, I will tell you. इसमें first is acupuncture में energy channels body में जाता रहता है. So people, the energy channels are there in the body. They are not nervous system. They are not nervous system. They are not blood vessels. They are not. They are not. You cannot identify those acupuncture meridians with any of the physical body. It is only the energy body which is not identifiable exactly. But in a particular line, it has been observed and measured that in a particular line, a particular energy flow will happen. So they are called the meridians. I'm going to talk about show the meridians, how each meridian will be running through in the body. Okay, so before that, what I just want to discuss is there is a clock, body clock. So how many of you know about this? You can raise the hand. Let us put it more interactive so that I'll also know if you have any doubts, you can stop me and ask me the questions, because today is an important session where everybody can heal themselves with the acupressure. Okay, so I just wanted to mention that we'll have the points, acupressure points and life-saving points I wanted to teach. Few life-saving points. So I request all of you to stay till the end of the session. Yeah. So here, what happens most of the times as compared to the ancient times to now, we are losing the timings. We are taking fast food, junk food, so many things, and irregular timings. Okay, but why? And we get into the lot of problems. What is happening here is we should understand that there is a body clock, body functioning. Each organ has its own high energy time, where it is, if you see, high energy time starts for lungs 3 a.m. to 5 a.m. Most of the breathing problems increase at this hour, 3 a.m. to 5 a.m. Then large intestine is 5 a.m. to 7 a.m. So when we get to the motion between the 5 a.m. to 7 a.m., it will be full and complete. And if we miss this 5 to 7 a.m. Going for the motion, it is very difficult. We get gastric problems, and then acidity problems, etc. We get. Okay, so now most of the times we wake up late, around 11 o'clock. Some next generation, younger generation people on holidays and all, they get up very late, and then their cycles are totally different. Earlier days, they used to get up early morning by 4 o'clock and do meditation, and then go complete all their work and eat breakfast and go to the field or work or business. So now, if you see, the large intestine is the motion jane ke liye 5 to 7 a.m. and stomach, that is take a heavy breakfast in the morning. So then when we take between 7 to 9 a.m., our stomach will work very well, because that is a high energy time for the stomach. Similarly, the spleen is 9 to 11 a.m. high energy time. Then the heart is 11 to 1, and the bladder, and exactly opposite of these timings. Suppose 3 a.m. to 5 a.m. is the lung we told, and 3 a.m. to 3 p.m. to 5 p.m. लंग का ऑपोजिट एनर्जी होता है, तो लो एनर्जी होता है उसमें, लंग्स में. सिमिलरली द लार्ज इंटेस्टाइन जब 5 AM to 7 AM हाई एनर्जी होता है, तो 5 PM to 7 PM लो एनर्जी रहता है लंग्स में, लार्ज इंटेस्टाइन में. So इसीलिए if you see this one, we have each organ, like all the liver, lung, large intestine, stomach, spleen, heart, small intestine, bladder, kidney, pericardium. Pericardium is the one which is covering outside as a protection wall to the heart. Then triple warmer, gallbladder, etc. Like this, each one has points, and each one has meridians, energy lines in the body. So now these things again are clubbed with the 5 element theory of earth, fire, water, then wood and metal. So when we go deep into the science of acupuncture and then acupressure or the body clock, etc. and all. We learn all these things in advanced acupuncture. But here today, what I just want to bring to the notice of the people, what I want to highlight. So large intestine calm 5 to 7. We have to get up early and then go to the toilet, motion, etc. Stomach 7 to 9. Take a good breakfast during that period. And similarly, if you want to play or do anything when the other opposite time of these things, you can go for the physical exercises, etc. Okay, so this is what I just wanted to bring to this one. So I have some problem here. It seems. Okay. Okay. So the acupressure points will open up a whole world of health and healing for you. It literally puts the power of power to the help yourself and others in your own hands, with your own hands. So this is there is a book called by Dr. Vora, Health in Your Hands. So with your own hands, you can apply the pressure in the body, and then you can cure yourself or treat yourself by applying a simple pressure here like this. Okay, pressing the acupressure points are same as acupuncture points. In acupuncture, we insert very thin needles up to the deep into the muscular level inside, go where it touches the energy point. But here we apply the pressure here anywhere here like this, or with the thumb and the index finger we can apply the pressure here like this. So like this or like this, we can apply the pressure here like this. This is the pericardium 6 here. So by applying the pressure, we are activating that particular meridian and that particular organ we are activating. Then effectiveness is almost the same, whatever with acupuncture and with acupressure. Sometimes acupressure works miracles and very fast. They release stiffness, stress, tension, and pain in the body. It's easy to learn and how to use acupressure to improve your health and well-being. So actually, these slides I prepared for one-day training course. But some of the things I cannot cover everything here as an introduction. But what I would like to show are highlights of the systems what we are talking about. So in the acupressure, I mentioned about the meridians. Shortly, I am going to come to the meridians. Before we go for the meridian theory, I cover reflexology, which is also the part of acupressure. Okay. So now, as you see in the left side figure here, if you make the zones, 5 fingers, 5 toes of the legs, 5 zones up to the top of this one. Similarly, with each zone of the left leg and right leg, if you are making it, 10 zones will get here. 10 zones of the legs, which if any problem is there in this zone, by going to the root of the nail of that particular zone, we will be able to clear the blockages within that zone. That is called the zone therapy concept. Okay. Similarly, we have on the fingers also. So from the 10 finger, the hand fingers also. So 5 zones here, they will go here from the hands and they go up here like this. So any upper and respiratory problems and upper area problems, we can go to the root of the nail of the fingers and then hand fingers and go and press. Otherwise, we can go to the root of the nail of the toe and then press it. So when I am talking the root of the nail means, it is like this. This is the nail here. Okay. So this is the root of the nail. So when we apply the pressure here, like this, we call it the pleasurable pain. Okay. When we are pressing here, if there is no pain, it is very light touch you are giving. There is an acu touch also. There is acu touch, just they press the point and then give the energy from there. Okay, we are not talking of acupuncture. We are talking of acupressure. So you have to apply the pressure here. When you apply the pressure, if it is very light and very, it will be ineffective. If you go slightly deep and press deep, there will be some pain. Okay, so we call it as a pleasurable pain. If you press too hard, and there will be a lot of too tough pain will be there inside. Okay, when we are treating particular meridian for any other part of the body, the reflex means it reflexes in some other things. So I'm coming to that in the next few minutes. So by going to the nail of the root of the nail like this, we are pressing it. All the blockages within the area we are clearing. So that means if we go to the thumb of the right hand thumb and press the root of the nail, it will be clearing all the zones, that zone up to the head level. It will be clearing any blockages. The concept here is when the energy blockages are happening, energy flow in the pipeline, if there is a blockage, the water will not come out properly. Similar way, when the blockage is there in the energy pipe, because of that energy flow will not be proper, then the problems will start happening. Anywhere it can happen after the blockage starts. It could be middle of the block, at the point of the blockage, or at the end of the blockage, or within the pipe. Anywhere the water will not be going. Similarly, anywhere the energy will not be flowing. So we clear that by pressing it. It is almost similarly, you can remember the water pipe and then clogging in the water pipe. Similarly, when we flush out the cloggings, water will flow properly. So when we go to the root of the nail and then press it, it will clear the energy here. Again, when we are talking of the foot from the top to bottom, like this, the bottom of the foot here, you can also solve by pressing it the point here, because the face is reflecting here. Face side fully is reflected into the 5 zones within this number 1 of the toe. So that means both the toes, when we are putting it together here, your body is exactly matching with both the foot. So there is an overlap picture. I'm not sure if I put it here, but you can imagine that both the feet are just covering from the top to bottom of the body. If you see here, the blockages should be removed by pressing it anywhere in the feet also. It's not only on the root of the nail. We can remove the blockages by pressing anywhere in the part of the body also. So this is how the zone therapy works. Now the reflex points, if you see here, if you see here the hands, there are the various, there could be some deviations with the picture what I am showing. With some other techniques like Ayurvedic acupressure comes out with the points differently. But you can observe here where the bladder point is coming, then head and brain portions are coming here, eyes are coming here. Particularly when you see here in the zone therapy, if you call it, this U shape for when we superpose our fingers here like this, the middle portion of the thumb is covering the face and middle area. And similarly, these two are covering our eyes, and the last 2 fingers are covering the ears. If any blockages, any problems with the ear, we can, by pressing it here, we can address. So if you see here, that in a U shape here, you will find the eyes related problems. Okay. So like if ear problems are there, we can go and press here. If eye problems are there, we can go and press here. If there is a again, the concepts will change, but just to understand that body is superposed here and reflex points are there. So when the problem is there, the point reflected points also will have pain. So when the neck pain is there, for the neck pain here, so the neck it is showing here, and this area also, the spinal cord area also will come here, and the neck pain is there, means we also get the neck pain. It reflects here. It's not that we are having a pain here on the finger. The neck pain reflex point is coming here. When we press here, we get the pain here. And when we activating periodically these points, the neck pain will reduce. Similarly, for the spondylitis, back pain, etc. and all. So So this is what is the zone therapy. With the zone therapy, there is very excellent exercise called the Swiso exercise, where we just swing our arms like this back and forth by standing on the foot and just pressing the toes, no, feet toes slightly inward, so that the points at the tip of these points there is a pressure applied, so that all the full zone is getting activated just by doing the Swiso exercise. Okay, so now you can see here how the foot reflexology is showing. As I have shown here in this picture, the zone therapy I talked, there also any parts related to the zone body are coming here. And here, this area is lungs here. You can see in the hands, the lungs here. Lungs area is reflected here. Heart area comes in the left-hand side, in the near third and fourth finger, the left-hand side, the heart area comes. Then similarly, the digestive system, the stomach area comes near the, because when we keep it here, this area, in this area, the digestive system will come like the stomach and esophagus, etc. So, by applying the regular pressure in the hands also, we can solve the problem. Okay, so now coming to the foot reflexology, so you can see here the frontal sinus area. So all these ears, you can see here eyes here, you can see ears here, कान देख सकते हैं इधर. Okay, इसका पूरा नाक और नाक related central portion इसमें आता है और brain का portion इधर आता है. जब भी हमको सर दर्द होता है हम इधर प्रेस कर सकते हैं, frontal in this area में प्रेस कर सकते हैं. Because this represents the front portion, as I have shown you here in this picture, in the top, for number one, the top area, and also when we are representing the top area of the thumbs, it is representing the middle portion of this. If there is either you can press here on the tip of the thumb, and tip of the toenail, toes also we have to press. And also for the, if you are thinking zone therapy, you have to press in the nails, with the root of the nail we have to press. Okay, so here you can see all the endocrine things also. You will find kidneys, you find this is the liver area here, and then spleen comes here, then kidney portion here, and then here pancreas also will come. Stomach is here, you can see celiac pancreas is coming here on both the feet. Kidneys are coming, uterus, urethra, bladder, sigmoid, colon, anus. Okay, so like this, when you are having full foot, full body is represented within this one, and you can just by going and pressing the points within your feet, you can happily solve the problems to a greater extent. I'm not saying 100%, but to a greater extent, where you may not require to go to any medical doctor or any doctor immediately. At least try to identify yourself. We teach how to identify the problem by pressing various points in the hand also. But here we are just as giving introduction. So this is a broad picture of how the body is represented in the feet here in the right side picture. Any doubts at this stage? Is it okay to go ahead? This is another wonderful system where you can see we have the, like as I mentioned, when the body is represented here, the eyes are here, ears are here, the lungs are here. You can see one lung here and the 13. Similarly, when the spinal cord is represented here on the body, on the side, the curvature of our foot to the side is exactly similar to the spinal cord. Okay, so this is the sacrum coccyx area, sacrum area. You can see here on the foot also, sacrum and coccyx, L1, L2, L3. So then T1, T2, T12, then C1, C2, C3. So here, when this area here, it is the cervical area. So there was one case where somebody met with an accident and then he totally bent and he was unable to, because there is a problem almost at this level, T3, T4 level. He was having a problem because of the accident. He bent his back totally. Then when I went to press here, just at the points here on the foot, the moment I was pressing it, the energy blockage got released in the back, in the spinal cord, and then he became very straight, and then he could have a full lung breath. And immediately he wondered, and everybody there, about 7, 8 people were sitting in front of me. Everybody wondered the miracle of the acupressure here. Okay, so like this, when the people are having, just apply the pressure here. I'll just show on the foot how to apply the pressure here. So probably it may not be visible, but I'll try to show it here. So you can see here the so are you able to see the picture? Mine is lagging actually, there's a lot of lag is there. So this is the area. You can just apply the pressure here like this. Like this, you can apply the pressure. Okay. Similarly, when there is, you want to apply the pressure here, you can apply the pressure here in within the feet also. You can apply. You feel then the eyes portion you can apply, ears portion you can apply, thumb portion you can apply here. So like this, no, when you can apply the pressure here with the full pressure is required here, because the foot can bear any amount of pressure here, because it is bearing all our weight. Whether we are 50, 60 or 100 kgs, it is bearing. So we can apply the pressure, any amount of pressure here, and then heal ourselves. Yeah, actually, I will release one video. It's video is lagging for me here for some reason, and I was unable to show exactly the live how to make it. With the hands only, I'm able to show it here. Sorry for that inconvenience, but yeah. So basically, it is the pressing the apply the pressure here alongside your feet here. Okay. So, and do you need to know all these points, and how do you learn? Even without knowing all the points, you can just apply the pressure. Which point where it is. If you are feeling any discomfort at any point in your body, just go and apply full feet. Apply pressure in full feet. आराम से बैठ के टीवी का चैनल का सामने बैठ के पूरा पॉइंट्स टीवी या कभी मेडिटेशन के लिए भी ग्राउंड पे भी बैठते हैं. Just apply, keep on applying the pressure with both the thumbs on your feet. For even for 1 minute, 2 minutes, or 5 minutes also you can apply the pressure depending upon where you are having a problem. One is by knowing where which organ is coming and which location, like this picture. If you are applying the pressure, oh, okay. Now, if you are without knowing also, just apply the pressure from top to bottom of the feet, you will be all right. You will see the good results. Okay. So here, some of the experiences I wanted to share. After covering experience, this also I'll just show it. So what is this? Is called the auricular therapy. Okay. So here in the auricular therapy, you can see the boy. This is inverted embryo, we call it. In the mother's womb, the child will be like this. And our ear exactly represents inverted embryo. Okay, it's not for, it is for all, it is the same thing. The principle is same, inverted embryo principle. Okay, so if you have you can see here the eyes and the brain are coming in the below portion, and neck area is there here, the equivalent of this. The spinal area is here. You can see the hand is reflecting here, one shoulder and hand, one body and the legs and the ankle. Everything is reflecting here in in the body here. You can see here the spinal cord is representing here. Then hand reflex points are here. Then here the ear center portion is there. Then teeth are coming here in this area where this one. And you can see the organs, how they are reflected here and all. So now one is you can know all these areas and then uh, press, because if you go to a specialist, acupuncture specialist, there will be some needle, not exactly needle, I say there will be some equipment to apply the pressure here like this. Any point to apply the pressure, there will be some equipment will be there. Okay, so with that they will apply here on the ears, but it will be very painful. What I suggest is, because you know now that all your body parts are represented in ear. So while taking bath or when you are sitting idle, just apply the pressure like this. Keep on applying the pressure. Of course, don't hurt your ear, and just applying the pressure here on the lobe here. You are addressing all your brain and eyes, all those areas, face, eyes, and then applying the pressure like this here. While taking bath also, you can apply the pressure. Happily just to spend 1 or 2 minutes in applying the pressure on each and every part of your body or each and every part of your ear. Okay, because this also reflects this one. So now from the olden days, how this is reflected, I will tell you. So of course, whether by knowing they are doing or unknowingly they are doing, and you know that the teachers, our masters in school, they used to squeeze the ear here like this here. Okay, so by knowingly or unknowingly, they are activating our brain. Okay, and because this is here the spinal cord here, many ladies, also for the ladies particularly, this is important here, piercing of the ears. Okay, because for them ladies, we require the lot of the hormones release and control of hormones, etc. and all. So when the piercing here happens, रिंग के लिए जब वो होल्ड करके रिंग्स लगाते हैं, उसका वजह से उसका हार्मोन्स कंट्रोल होता है लेडीज का. Okay, so then when you are applying the when you can see the village ladies, lot of them, they wear rings here also at the top of the side of this one. Working ladies particularly, like those who the hard work they do, खेत में काम करता है वो लोगों का, वो लोग पूरा इधर इधर भी होल्स होता है, इधर भी रिंग्स लगाते हैं, क्योंकि वो लोग बैक पेन नहीं आता है, क्योंकि वो पॉइंट्स टच कर रहा है इधर. Okay, so like this we can apply the theories of our regular things. So what my suggestion is to keep yourself healthy, spend 5 minutes on your ears, just apply the pressure here, just apply the pressure and then start using like this. Okay, keep applying the pressure overall ear until within 2 minutes you get your whole body becomes a heat when you are applying the pressure here. So that means energy recycling is happening. Any questions at this stage? I just wanted to stop sharing at this level. Okay, so any questions at this level? Okay, so the next is for some reason my system is becoming slow and movement of the slides is a bit poor here. Let me close some apps here. Okay. Okay. Okay, so what we are talking of is okay, so we discussed about the zone therapy, reflexology, and now I will give brief introduction about meridians, how the meridians. So there are 14 meridians which are I will say this. There are total 12 plus 2. We call it, we don't call 14 meridians, but we call it 12 plus 2 meridians. I don't know exactly a reason why 12 plus 2. The 12 organs which are connected. The 12 organs are 12 meridians. That what are the 12 organs? Heart, lungs, liver, pancreas, spleen, then stomach, kidneys, gallbladder, urinary bladder, like this, the 12 organs, whatever are there. So for each and every one is a one meridian it is having, and various points are there on each of the meridian. The advantage of, as I was telling you, the advantage of the acupressure is when we are applying the pressure, we call it the pleasurable pressure. Don't press too hard so that the local area gets tender. Second time you cannot press. But if you apply the very light pressure, you cannot really solve your physical problem or whatever the problem we are having here. Okay, so it is a balancing is what is required between the hard press and light press. Okay, so now the 14 meridians I will just show where they are going, and afterwards I will tell you which are important points for the life saving purpose, and then what we can do it is I will show you that. Okay, so and you can stop me anywhere if you have any doubts or want to ask questions. So this is called the heart meridian and the small intestine meridians. Two meridians are there on the last finger here. Okay, one meridian, one is starting inside of the finger nail. So I hope it is visible here. This is the nail if I put it. So this is the point here, the H9 point. Okay, so H9 point comes. I will try to mark it with red so that you can see in the picture. So are you able to see the picture here, the red point marked? So that is the heart point. That is inside of the nail, we call it inside meridian. Outside is the small meridian, small intestine meridian. So like this, this heart meridian is very, very important meridian. When appropriately pressed in time, we can avert heart attack. Even if a person gets a heart attack, we can try to recover him from the heart attack very quickly. So H9 and H7 points are very, very, very vital. So people can note down. Of course, we will share if you are interested. Those who are interested can contact me separately for a class or session, full session on the acupressure. I can teach them. So we can these things. There is an app actually. The mobile app is available. There you can easily see, locate the points, each of the points, how they are, where they are placed. So only thing, one suggestion for all of you is, one takeaway for you from this session is, if there is a heart problem, whether heart problem is there or not, daily, we call it curative and preventive. For cure purpose, if there is a problem, to cure the problem, 14 times we have to apply the pressure. If it is a normal preventive problem, 7 times we have to apply the pressure. So here I'll tell the name of the app later. You can download later. Okay. So this is the point here. If somebody can press here like this, or you yourself can apply the pressure on this one. So when you don't know, when we are talking, I talked of in the zone therapy, just go to the root of the nail of the little finger and then apply the pressure here like this. So the heart meridian is same on both the left hand and right hand. Heart and small intestine meridian are same on both left hand and right hand. So we have to apply the pressure on both the hands to balance the energy. Okay. So balancing of the energy is important. So apply the pressure here like this. I'll just come close. Because the outer side I am not touching, only inside I am touching. Apply the pressure 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 14 times if there is a curative. Suppose if somebody is facing the problem with the heart, you can this one. I am not talking of the love heart here. It is a physical heart and heart functioning. Okay. So here I'll just share one example here with the heart and the zone therapy also. I will share that examples what happened and how I treated, etc. So the H point, H9, 8 and all are there, and the small intestine problem points are here, the more. In some of them 8, 9 points, and some of them 20, 30, 40 points. More points are there in longer meridians on the legs also. Okay. So S1 is starting at the last finger, little finger, and then going on like this, and then going up to the ear up to S19 here. Okay. So then comes the triple warmer. Triple warmer is your Vata Pitta Kapha. Triple warmer is Vata Pitta Kapha. The second finger it is starting here with the second finger, and you can see the where it is starting in the second finger again at this point. So go to the second finger outside because from the little finger the point is from the little finger to the inside of the ring finger. So this is called a triple warmer. Triple warmer is Vata Pitta Kapha is balanced by pressing these triple warmer points. So in the zone therapy also we touch the points like this. We press the points both near the nails, we apply the pressure. So that means whether you know the points or not, the particular meridian, you go to the zone therapy and then apply the pressure on the near the nails, because some point or other of each and every meridian is there on all the fingers. So when we apply the pressure like that, you are solving all the problems. So all the 12 meridians and 10 fingers, you can go and apply the pressure. You find all the organs are working perfectly for you. Okay. So you don't have to know full theory of acupressure. You don't have to know anything of each point, how to work and all. The basic thumb rule is apply the pressure, pleasurable pain. Second thing is 14 times for curing, 7 times for preventing. Okay. So this is triple warmer, Vata Pitta Kapha, pericardium to strengthen your heart. We can press this pericardium point again. Okay, the pericardium point where it starts, you can see here on both the fingers it is there. So it is starting from the middle of the finger and it is going inside the hand, whereas the triple warmer is going outside the hand. Okay, so the points are going outside and this is going up to the here. PC1 is starting here. Okay, pericardium one. Then large intestine and lung points. So this is very important. Large intestine, it starts on the index finger and comes here Li4. Here you can see here. My hand many times when I was showing the point, the large intestine point I was showing actually Li4, large intestine, because this is when we open the hand like this and when you put the web like this on the web vertically, the point will go. So this is the large intestine 4 point. Now you may ask why Li4 is coming here when the large intestine is the bottom. Okay, but that is how the energy flow is happening for this. Okay, but this is the point where your one of the Sarvaroga Nivarani point. Sarvaroga Nivarani means for many problems you solve by pressing this point, the Li4, large intestine. Okay, so similarly, the lung point is starting from the thumb. So this is starting from the thumb here. The lung 11 is starting here, and it is going like this, the meridian, like this. So if there is a severe problem, when we when we stretch our hands at a horizontal to our shoulder, and then keep our thumb like this here. This is the point where lung 1 and lung 2, just within the 1 inch difference, you get 2 points. When we apply the pressure, when we feeling because of the humidity or because of the change of environment, when we are feeling breathlessness, such kind of a problems, you can have this, apply the pressure here, L1 and L2, lung 1 and lung 2, lung 1, lung 2. Okay. So this is very simple. Stretch your hands, hold your hands horizontal, and apply the pressure here. Okay. So this will be all the breathing, many breathing related problems it will solve. Similarly, you can apply the pressure here, apply the lung related problem. Again, as I mentioned in the zone theory, it is the root of the nail. What we are talking of, the root of the nail. So when we are applying the pressure here, so it automatically gets this one. So now we discussed all the 6 points in the hands. What are the 6 points? Heart and small intestine, triple warmer and pericardium. Pericardium is the one which covers the heart and then protects the heart and the heart functioning, etc. and all. So there are more functions for each of the point. Actually, there is different functions. I'm just telling a broad introduction, just to be aware of the thing. So when we are applying the pressure here, P6, pericardium 6 here, and the triple warmer 5 here, certain points are there where we can apply the pressure, and then you can get healed yourself. Okay, so this is what all the lungs, large intestine, lung, and all. Now, as I mentioned here, in the zone therapy, all these fingers. Where are the fingers? Okay. The fingers here, 1 to 5 fingers are there. The heart and small meridian on the last finger, then triple warmer on 4. Number 3 is pericardium. Number 2 is large intestine. Large intestine. And then number 1 is a lung point. So these zones, when you go and apply the pressure for each of the fingers here, you are directly touching the points of acupressure meridians of heart, small intestine, lung, liver, large intestine, lung, pericardium, triple warmer. Triple warmer is not an organ, but it covers vata, pitta, kapha. But the triple warmer has a set of organs. What it covers here, the last slide is there. It is the vata, pitta, kapha. You can see the lungs are kapha, pitta is this area, abdominal area, vata is the lower area. So I'm not going to deal with this right now, but the vata, pitta, kapha is your triple warmer. Okay, so 7 is the spleen and liver. This is very important for the so many problems. For ladies problems, menstrual problems, diabetes problems, spleen 1 and spleen 6 here. You can see the toenail, the big toe, whatever is there here. Big toe, whatever you are seeing here. Spleen is a one. Spleen 1 it is. Spleen is again, it is pancreas and spleen both together it is. Okay. SP is called spleen pancreas. Okay. So these points covers both the spleen as well as the pancreas. For the diabetes control, the SP1, SP2 points are important. And even SP6 point is important. Okay. For the menstrual problems, scanty problems, and excess, all such problems, by activating the SP1, SP2, and SP6, you can solve the problem. Okay. So this is SP6 is one of the miracle points, 8 miracle points that I'm going to discuss today as a takeaway for you. And Then here the LR, liver. Liver 3, again here it goes. You can see how the liver point goes here. Liver 3 is one of the important points here. For many liver related problems, go to the liver 3 and then press here. Many other problems like eye problems, hearing problems, vomiting problems. Vomiting, you are not getting a vomit, you are getting a nausea, feeling like vomit, but vomit doesn't come. Just go to apply the pressure on the liver 3 and stomach 1 and stomach 36. Stomach 1, or it will come in the next meridian. I will show you here. And here in the beginning of the stomach 42, it is called. Okay, stomach 42, that is in the next finger, the third toe, it comes here, stomach meridian. So now you see here the stomach meridian, how it is, the liver, the spleen meridian is covering both. Spleen comes on the left side of the body, and the pancreas comes behind the stomach on the middle of the arm. So SP6 is directly touching the pancreas, and then here this SP14, 15 are touching the points of the spleen here, and then it is going up to the top of the body here. Okay, and similarly here also you can see the how beautiful, how many points are there on the stomach. The stomach point, stomach 1 is starting near the eye here. Below the eye here. Yesterday, I think I was talking to Prem Kumar. I hope he is available here. So you can see here the stomach 1, stomach 2, stomach 3 points and 4. Like this, the points will come here from the top and it will come up to the body and then come up to the total down up to the second toe here. Okay. So when there is a nausea and then vomiting is not happening and a lot of discomfort is there, when we press this liver 3 and the stomach 42 and stomach 36 points, 36 is here, you can see here, stomach 36, immediately within few minutes you get the vomit. Okay. And for digestion problems, stomach 36, many digestion problems. Okay. So like this, when we apply the pressure at one place here, the blockages in all the overall meridian, the blockages will be removed. Okay. Next one is the kidney and this kidney and gallbladder. So the gallbladder comes on the right side of the just below the liver, gallbladder comes, but its meridian points are coming from here. All through the points are going up to here, and you can see the gallbladder having even up to the neck, and the whole of this one brain area is covered with the gallbladder. Is one side of the leg it is shown, the other side of the leg also same, the points will be there for this point. So it is covering most of the points, most of the body points are covered here with this one. Okay, so the kidney 3 point, kidney 3 and kidney 6 are very important. When we are traveling, we get a lot of times what you call the swelling in the legs, because we keep our legs in the down. So that time before traveling, just apply the pressure on the liver 3 and kidney 3 points. Liver 3, I have shown you here. It is in the middle of the two big toes, first two toes, and the deep point is the liver 3 here. Okay, so that when we apply the pressure on the liver 3 and kidney 3 point, kidney 3 and kidney 6 point, the urination will improve and swelling will come down within few hours or few days. It depends upon. Before going for the travel, you apply the pressure. If you are particularly traveling in bus, you can apply the pressure before boarding the bus, and then keep applying the pressure during travel also, 10-12 hours of travel if you are having. So then swelling will not be there. Otherwise, you cannot wear your foot, your chappal while getting down from the bus. Okay, and the kidney point starts, the kidney 1 point starts here and then it goes like this here. And this also has for the knee pain also, we apply the pressure for the kidney point, and gallbladder points also for apply for the knee pains here. Okay, Then 10 and 11 covered. UB is the urinary bladder. You can see it's a whole lot of full body is covered with the urinary bladder, which starts from the where is UB1? Okay, UB1 is coming from the almost from the here the eyes, from the starting point of the eyes here near the nose. From there it is going up and then making so many curves here the points, and then it is coming down. Now, how you may ask the question, even I had a doubt earlier, how do we know exactly so many points when the meridians are overlapping and where meridians are so many points are there? Without knowing, I solved so many problems. Okay, so if you know correctly each point where and how, some points at least we should know, and with that minimum few points, we will be able to solve many problems. Okay, so now these are the organs directly connected 12, and then this is called the governing vessel. The 13th is, that's why I told you the 12 plus 2. Governing vessel is, it is starting here GV1 from the back of this one, and it goes all along the spinal cord, and up to here it will go, and up to here it comes. The GV26 here, the point what you are seeing here for the particularly, this will be very helpful when somebody is fainting or they are getting a fainting situation. Okay, apply pressure, and for the hypertension we will come to that a little bit now. Okay, so this is one. Governing vessel, there are many points on the all along the central line of your head. It is there. Then conception vessel, CV24 is starting just below the lip, and then it is going down to this one up to here in the below to cervical area, this area, sacral area. Okay, so now these are the 14 meridians. CBR REN also it is called, and in internet if you search different names also will appear, but generally these are the concepts. Now first I will start with there are okay, so before I start some of my experiences I wanted to share, and these are important acupressure points I just wanted to share to you for the betterment of your health. And now it is 8:10, maybe another 10 to 12 minutes, 15 minutes, we will try to close. Okay. So one of the, one announcement I would like to make here with this acupressure points, we started doing the eyesight improvement program and the hearing improvement program. The applying the pressure here around the eyes here, and there are various points as you have seen, urinary bladder, gallbladder, stomach, and so many points are there here. By activating the points in the inner circle, middle circle, and the outer circle of the ears, and some other points here and here, we have seen very good progress in the eye vision improvement from Acupressure and Acupuncture Academy, Dr. Bojraj, who is heading that, from whom I learned acupressure, and he is my guru, first guru for any alternative therapist. From that, when he came out with these points, set of points for the eyesight improvement and hearing improvement. So the many people actually, one ISRO scientist came and then asked for the cataract. So he wanted to avoid a cataract operation, because sometimes we have seen the cataract operation fails and then people have many eye problems they have got it. So he wanted to avoid that. Then when he tried these particular set of points, immediately he came out of the cataract issue, and then the cataract operation was not needed after 1 week to 2 weeks later when they tested for the eyes. The cataract has gone on its own with acupressure. Okay. So then when the specs for the children, when they are wearing specs at a very small age, like 7 years, 5 years, etc. When we do this acupressure, there is every chance that they can remove the specs, and then eye vision will improve. Nowadays, everybody is glued to Netflix or whatever, the mobile or laptop or whatever the usage, and then people are getting it in a very small time itself. They are getting they are getting the points they are getting the eyesight and then this one. So by applying those points here, we can reduce the eye strain. Sometimes we can correct many people. We last 2 years we have done research about 40-50 people or 60-70 people came up for the 2 batches, and then they have quoted many problems. And that is a totally 3 to 6 months period, a 3 months period. We are trying to help the people with weekly monitoring. So that is a separate activity. I am not covering much details here, but what I want to tell here is there is a possibility of removing the eyes spectacles and improving the vision. And my own points when I have tried regularly, from left eye was 4.5 and right eye is 4.0. So in both the eyes, it has reduced to 0.5. So 4.5 became 4 and 4 became 3.5. And some of the people have removed the specs and some people have removed the cataract operation. And even glaucoma has been solved with this one. Okay, there was a recently one video where I shared it probably. So we do something like a research kind of a thing. 3 months monitoring will be there. So there is we charge something for this one. We'll see that later. I will make an announcement. Similarly, the hearing improvement, the sound within the ears, and then the low listening. That means both there will be the frequency of decibels, whatever we hear. It differs from one ear to the other ear. From one ear we can't hear, and many people you would have seen that they keep the hearing aids in the ears. So we can prevent, particularly after the age of 50, 45, 50 years, hearing problems will increase. So we can try to avoid those problems by going for the acupressure therapy with the hearing improvement. So there was the same scientist who avoided cataract operation. For him, the 40,000-50,000 rupees he spent for getting the hearing aid, he removed it, and he is very happy because with acupressure his hearing has improved, and my own frequency of the hearing has improved by 600 to 700 kilohertz, 700 hertz with one of the ears here. Okay, so this is again we monitor on a weekly basis. People register for these two programs, and it is a separate 45 minutes presentation will be there, and teaching will be there, and weekly monitoring will be there. Then you can come back to us, and then we will record the points, how the improvement is coming. So you can register, and particularly those who are in your family members, those who are there, you can help them to register for this, and then help them. You learn and then help others. That's also fine here. So another important point before I go for that, because we are on the CV here. So many times thak jate hai, fatigue. We can't do, and we just ढीला हो जाते हैं पूरा body, कुछ भी नहीं कर सकते, पलंग से उठ भी नहीं सकते. We can't even get up from the bed, and we feel very tired, and fatigue will be there. So just apply the pressure, very light walk it is with the 2 or 3 fingers to apply from here to here like this. I hope you are able to see this clearly. Apply the pressure like this here. Apply the pressure from throat, neck, throat point here, middle point. That means CV22 to up to at least navel. That is CV10. You can come, or maybe you can come down below also. Up to pubic area you can go down like this. Just apply the pressure here like this. Okay. So now with this, I have seen many times very close relatives, when they are tired, within 2 to 3 minutes, they were just almost fatigue with the fatigue, they lie down on the sofa. So within 2 to 3 minutes of doing like this, they get up, they get fully energized and charged. So this is no other technique you can do. It is within your own hands, within on your body. जो भी काम करते हैं, घर का काम करके थक जाते हैं, just apply the pressure here by standing itself you can do, and you can actually improve. And also people, those who want to make it a habit in the morning when you are getting up, you can just apply the pressure on the bed itself and then get up. So what we have seen some tremendous changes in their behavior, in their attitude, and in their in their confidence level and then achievement level. So they wanted to achieve something, but they are not able to focus, not able to do various reasons. Just apply the pressure. I am doing well. I am doing well. I am doing achieving so many things. Like this, when you are applying the pressure here, miraculously there is a lot of change in the people there. Okay. So this is what are the announcements, and then takeaways for you. I have already told you H9 point, heart point here, and somebody gave the feedback uh, in one of my peers. Somebody got the heart attack, and by the time he was put into the car and taken to the hospital, he was pressing this point for him. And by the time he reached the hospital, doctor said he is fine. The intensity or criticality of that particular heart attack, whatever the person has faced, it has reduced. What happened? Only thing is he was pressing it here. So this is a wonderful first aid point. Please note down, wonderful first aid point for any heart related problems. Daily, if you are applying pressure 7 times, it is a preventive, 14 times curative. Okay. So then personally, when I came to one of my colleagues was presenting some topic, he started drinking a lot of water. Then he almost was sweating profoundly, and then he was almost collapsing on the chair. We just held him. I just because in any first aid, because I got trained in firefighting as well as a first aid also from my organizations. Remove the belt first, loosen the shoes, because that air, breathing and air will flow for them properly. Make them that there should not be any crowd overcrowding the person, and just make them here. And then I pressed only 2 points for him. One is the heart point here, and other one is the lung point. So simultaneously, I was holding the 2 points here like this, and I was applying the pressure for 14 times on both. And then for apne aap ko kya karte hai? That you can't, nobody is there with us. So apply the pressure just like when you are holding your hand like this. You can say here in these 2 fingers, the index finger, thumb and index finger, when you are holding from the back, exactly the points, it falls here. This again, they are interacting with the lung point is coming here, and then heart point is coming here. Apply the pressure here, or apply the pressure for yourself here like this. Apply the pressure like, I don't know, I can't show you. Okay, like this you can, like this you apply the pressure here. You can see the thumb here, and then you can see the index middle finger here. Apply the pressure here. And exactly the same thing I did. Within 5 minutes, he recovered, walked up to the lift about 100 meters, and went to the doctor, and he was immediately sent by ambulance to the big hospital. Next day, he called me and told me, Rao, you have saved my heart attack. So that is the greatness of acupressure. So he was about to get the heart attack at that moment of time. And when we sensed it, because we were in a session, class session like this, and then he was profoundly sweating and then falling, then I pressed this. Same person, another time what happened? In the morning, 9 o'clock, when he came to the office, his fingers got cold. It is so cold. Since morning 5 o'clock, he was not able to move his fingers at all, and no movement in any of this side of the part. And he is worried. And by the time I came to the office, everybody was looking, where is Rao? So then I just went and applied the zone therapy first, because when I touched it, it was ice cold. That means blood circulation has stopped. Then I have applied the pressure here on the zone therapy points I have pressed, and 1 or 2 other points I have pressed here. Immediately he could lift the paperweight. He was demonstrating to other colleagues, saying that I was unable to touch, I was unable to fold, or I don't have the sensation in the fingers. within few minutes when I press it, not even minutes, seconds, as I keep pressing it here, the hand became warm and then he was able to lift the paperweight. That is the power of acupressure. Okay, if you learn this acupressure, you can save yourself and you can save others. Or at least for yourself, you can use this acupressure. That's why I call it as a self-healing technique. Then Li4, as I told you, this is hyperacidity, constipation, vomiting, etc. The Li4 point comes here. So the mount, how to identify is when you spread your both the fingers like this, you can see the full mount here, and you have to go vertically here at this point. This is the one Li4 point here. Okay. So this point you can apply the pressure with gymming. We call it acupressure thing. Gymming. Our best is I don't suggest any equipment. Just apply the pressure with your hands. Okay, stomach 36 comes on the leg side here. As I said, the tiredness, leg pain, stomach problem. If you want, I can show the point here again. So this is the outer line here. You can see stomach 36. You have to measure 4 fingers from the down of your knee joint, knee cap down on outside side of the bone and apply the pressure here. Okay. So maybe in some other session I can show correctly the point, but you can see here the where the point is. So the applying the stomach 36 point, it is very, very important. Applying the daily this one, all the digestive system activities you can keep active, and then it is a very good medication for you. You don't require further some other thing for the digestion, digestion kind of a thing or anything. Okay, so now with this, we are addressing the gas problems, the digestion problems with the stomach 36, and then hyperacidity and constipation problems we are addressing with the Li4. As I have shown you, we are addressing all the H9 problems here, the heart related problems here. Okay, so then K3, K6 is again, I have shown you that behind the ankle one and below the ankle inside it comes 3 and 6 points. As I said, that it is for the removal of the toxins from the body, along with any other point. When you are pressing K3 and K6, urination will improve, and then you will be in a position to what you call toxins will remove, and you will improve your this one. And also when you are pressing along with the liver 3 point, the what you call swelling in the legs will reduce, and the tonification of the liver also will happen, like fatty acid and other points. Of course, there will be some set of points which we can use for this one. So kidney, most of the people for the diabetes, this kidney 3 point also is required. And SP1 and SP6, spleen 1 and spleen 6, as I mentioned, diabetes points, menstrual problems and sciatica and varicose veins, etc. we can address by pressing this one. I'll show you again where the point of the spleen and 6. You can see here the stomach, spleen, and okay. So spleen 1 is the outer line, the inner line of your thumbnail. From there it is going. The near the root of the nail of the thumb is the spleen 1, and 4 inches above, 4 fingers yours on the bone side from the ankle. If you put it, that comes a spleen 6 here. Okay, so or maybe the simple I try to show, but the picture is not coming properly if I try to show. I hope you are able to see it now. Okay, so this is my ankle. From ankle, 4 fingers on the above 4. This is called the spleen 6. This is good for the diabetes and good for the menstrual problems. And this is one of the Sarvaroga Nivarani point, 8 points, which I was talking of, to upkeep your digestion and spleen and so many things. And this is the liver 3 point comes here. The big toe, the first 2 toes are here, and it comes here the 3 points between the first 2 toes. Okay, so this is the liver 3 point, and kidney 3 is here. This is the ankle point. Here is the kidney 3. I hope you are able to see this properly. Okay, so this is the ankle. Okay, this is the ankle from inner side of the ankle 3, and down slightly down is the kidney 6 point. Okay, so that is the point that is there. Okay, asthma and breathing problems. As I mentioned while teaching about the lung problem itself, lung meridian. When we stretch your hands, and you will find here, when you stretch your hands and when you open your thumb and applying the pressure here, that is the lung 1, and slightly above the lung 2 here. And apart from that, you are go to this point, lung point, and then here also it is their points. Okay, so that is, and another very important point, you take your hand like this, the middle finger, and keep on your this one. Suppose people, those who are suffering from asthma, and they can go here and apply here the pressure on the back side of it, which is a B13 or something, which comes there, bladder comes there. Here, apply the pressure like this here. Once in the midnight around 2 o'clock, some bachelors were there, and one of them was having an asthma attack in the night, 2 o'clock. So then, when that sound, when I heard, I went down to their house and saw that. Then immediately I pressed these points. When we are pressing for others, we have to hold like this with the clavicular bone, we call it. Apply the thumb here, the front side it will come, and then hold like this and pressure with the 2 fingers. Immediately within 2 minutes, his breathing has been set right. That is the power of Acupressure. And the high BP, H9, GV20. GV20 is, as we mentioned here. So this is the middle point, it comes. The middle point, and the H9. This is the high BP. Low BP is the C17. Here it comes C17. Between this breastline here, between the nipples here, it comes the CV17. It comes, and then H9 is for this one. That is for the low BP. Knee pains, stomach 36, spleen 9, and K10. So those points. And the fatigue, I have told you already, this CV10, like this it comes. Okay. So these are the points here, and with all these things, I said, you will repeat all your these affirmations. I am happy, healthy, wealthy, slim, strong, and fit. All my vital organs are working perfectly. I am happy, healthy, wealthy, slim, strong, and fit. All my vital organs are working perfectly. I am happy, healthy, wealthy, slim, strong, and fit. All my vital organs are working perfectly. As soon as you are doing the meditation, in the meditation also, you can do these affirmations and be more healthy. Sarve Jana Sukhino Bhavantu. Thanks, all my gurus. Thanks to all masters who have listened here today. Any questions? I'm open for this now. So we can, all of you, I request to open up their videos so that we can have one picture, and we can close. So any feedback, any questions? If it is good, you please tell me good. If it is not good, you can tell. One thing I just wanted to share here, two more experiences I want to share. I want everybody to open their videos. Audio is making a lot of noise, somebody's audio. Okay, so see, when I learned this very newly in 93, 94 Acupressure, I learned. I think Annapurna madam, you may have to mute yourself. Okay, sorry for that. So when I learned very newly, I went to Hyderabad and I went to my grandfather, who was about maybe around 70 plus years at that time. twice he got paralysis stroke. Then for 45 days he was on the bed, and he is not able to get up from the bed, and then he reduced because everything is happening in the bed, and then he reduced his intake because he is becoming a burden to the son, and son is doing everything, washing, cleaning, and everything. When I went there and started applying just kya tata nana bolte hain na, the nana ji, I just applied the pressure on that and immediately felt a lot of energetic, some difference. Then what are you doing? He said, I learned Acupressure like this. Shall I do for you? Because I was very eagerly looking for the people who can get healed with whom I can help. I was also enthusiastic because just 6 months before I learned where to use, I don't know. So the first day when I have applied pressure, I don't know. What I did is zone therapy and some of the acupressure points. Zone therapy is again the going to the root of the nail of both all the 10 fingers of the hand, 10 fingers of the toes. Foot. Apply the pressure, zone therapy. You don't require to know anything. And then I did some foot reflexology. You don't require to know which organ, where it is there. You apply the pressure inch by inch, or maybe as you go centimeter by centimeter, each point in the hands as well as this one, you are activating all the organs. Then first day over, when I went, he requested me second day, can you come tomorrow also? Because normally when I go to Hyderabad, one day I will visit him and come back. He said, second day you come. I went there. He tried to held his bedspread and got up on his own without my support, without anybody's support. That was a miracle, wonder. Then I did that day also. He said, requested me, come tomorrow also. Third day, I went again. Third day, he wanted to get down from the cart on his own. He wanted me to support him. I just stood behind him. He got down from the cart, walked 10 feet up to the toilet in the room, and came back. After fourth day's treatment, he walked 20, 30 feet within the hall. Everybody was wonderstruck, including me, because uh, it was only hearing said, because my also guru also used to say, don't believe me when I am telling. Just experiment yourself. There is nothing wrong. You are not losing anything. It is your own hands and your own pressure you are applying, and the energy will improve. And this is the best case I can ever forget. And after that, he was almost 78 years. He was very healthily he was living. Then another case where I can tell you is 2 more minutes, 3 more minutes. I'll just close this one. Another case where my uncle, one of the senior uncles, who is also about 75 years, we both walked about to 10 to 12 kilometers from Hyderabad Zoo to Chikkarpalli, our house. Such a person. And he was spiritually, when he speaks, 10 hours continuously he speaks, such a great orator. He never stops in between, and many 10 people, 20 people, 30 people, he keeps sitting there. Such a person, when I went to Hyderabad, he was unable to walk more than 10 steps and unable to speak. And there was some heart enlargement problem was there, and then chest burning was there. I asked him to come to our house where I can try to do the acupressure for him. He tried to climb 3 steps. Everybody feared. 3 floors he had to climb because no lift. 3 floors में हर एक 10 steps, 5 steps में एक बार buttermilk, एक बार water, एक बार buttermilk, एक बार water, एक बार coconut. Like this, for every 5 to 7 steps, he was drinking something and climbing up. After climbing and he settled down, the almost next day I started treatment because he's tired of this one that day night. First day when I pressed the points, he felt very energetic and he used to bear the points, because one of the points is when I am pressing here, ladies generally cannot bear the points. They are ready to bear the original problem, like either migraine or headache or anything. But if I press here somewhere, you don't press. It is hurting me. So at least in the house, it is difficult for me to do. So like this, but he was able to bear even at the age of 70 plus years. First day over, second day, he started asking me to get the books I want to read. So Direngala, Vora, like this, several books which were coming, 10 rupees, 20 rupees at that time. He read the techniques of acupressure. He learned the points of acupressure. Meridians he understood and learned. And the second day, after second day, he climbed the fifth floor, the fourth floor, which is on the terrace. We are scared. I am scared really. If he is going up and further, if he cannot come down from there. But then he came down, and then fourth day he walked. He 1 kilometer walking he has done on our terrace. Fifth day he went down all the 3 floors and reached to my another uncle's house. We both went and came back without stopping. All this 3-floor building he has climbed up. And he learned acupressure without stopping, without coconut water, without buttermilk, without water. He climbed up all the 3 floors without stopping, but after walking for 1 kilometer. That is the greatness of acupressure. What I did is apply all the pressures on the acupressure meridian points, zone therapy, and reflexology. That's all. Whether you know the points or not, the system will work. And for my own son, when 2 years old, he was getting a lot of fever and cough, cold. When I applied pressure in the feet, just to reflexology points, he was, for next 10 years, he didn't get any cough, cold, fever, etc. So that is the power of acupressure. So people, those who are interested for the registering eyesight problems and then hearing problems, please register and personal messages me. If you want any suggestions, you can get. There will be some charges for those things. Even if you want to learn also, because outside the spiritual tab, this is being done here. So that's all I want to mention here. So we have seen very good improvement for the eyesight as well as the listening, and very good acupressure. If one learns, they can help themselves. And as I mentioned, that 8-9 points, whatever that for the heart problem, lung problem, liver problem, and breathing problems, etc. People can use that. So Sarve Jana Sukhino Bhavantu. Here I want to end. And the people who have any feedback can just send me a message personally also, or Anu Madam also, you can give the message.
Thank you. It was very informative. I do not have your number, so how do I contact you?
I'll type it in the chat. So 9845379198. Okay. So my name is Srinivas Rao Surampudi, and this is the one. If you know any of these coordinators like Soumya ji or Anu ji also, they will be able to guide with the number. Okay, so if no more questions, we can you can note down the numbers there, 9845379198, and yes, thanks everybody for patiently listening and attending for this last 1.5 hours. Thank you. Sarve Jana Sukhino Bhavantu. Let God bless you all. So we can close if you want with the meditation.
Thank you, sir. Very nice talk. Thank you, sir.
Thank you. Thank you.
Thank you very much, sir.
Thank you, madam.
Thank you, sir. Could you repeat the number once again? 98453
9845379198.
198. You're based in Hyderabad?
I'm in Bangalore.
Bangalore.
Yeah. How about you?
I'm in Dubai.
Dubai. Okay.
Yeah.
Krishna Subramanian.
Okay, so shall we close with the 2 minutes meditation? Arunaji, can you guide us for the meditation?
Sorry, sir. Today I'm not well.
Okay, fine. Okay.
Yeah,
Okay, just close your eyes and then just have a deep breath.
Yes.
Just let us close in 5 minutes. So just have a take a deep breath and gratitude to the all the masters and for helping us for this session. And thanks to all the gurus for giving me this these information skills, and thanks for conveying this message, and thanks to all for listening with patiently. Last 2 minutes. Last minute. Last 10 seconds. 5, 4, 3, 2, 1. Slowly rub your palms. Keep on your eyes. Take a deep breath. Thank you. Anu madam, can